places that still have a long way to go and still have a lot of measles around and a strong incentive to keep vaccinating, they're actually continuing to do better. But it's the places that have been historically successful and have to spend money and effort to maintain that success. That's where we've seen the erosion, and that's where we're seeing the backsliding, and that's why we have this unfortunate mixed bag, and it's disappointing and disconcerting. My name is Matt Ferrari. I'm a professor of biology at Penn State and the director of our Center for Infectious Disease Dynamics. So the World Health Organization just released its annual results on the number of measles deaths that have occurred worldwide. And the exciting thing about this is that those deaths have continued to decline. We're down 88% from the benchmark year of 2000, which is a fantastic and sort of global success and a testimony to the success of vaccination programs worldwide. The challenging and confusing part of this is the absolute number of cases reported have actually gone up. And really what we're seeing is a resurgence of measles in many places that have previously been able to control it. In fact, the number of outbreaks and the number of countries that are reporting outbreaks has gone up and has gone up steadily for the last couple of years. We're seeing this in the Western Hemisphere. We're seeing cases up in Canada and cases in the United States, but we're also seeing this in Europe and South Asia and the Middle East. And so thankfully, we're not seeing as many deaths associated with those because this is measles coming back into countries that have reasonably strong health systems and have been able to protect those kids and keep them from dying. But they can't avoid the illness that's associated with measles infection. Even though children don't necessarily die in high-income settings with medical attended cases, they might still have neurological complications, strong fevers that can lead to seizures and things like that are quite scary, but it can also lead to long-term consequences like loss of hearing, and then subsequent consequences for the immune system. And in fact, those kids that have recently had a measles case are more susceptible to severe disease from other common infections down the road. And if we now have to fight on two fronts, right? One, to help advance the places where measles is still prevalent, we're having success there. But now we also have to change the fight and really focus on maintaining the successes that were previously achieved. And that's going to draw time and energy and effort and money away from the other important fight. And so again, it's changing the game a little bit and increasing the fronts on which we have to fight this deadly disease. Folks that have been around measles and have measles around, they can see it in their community. They can see children harmed. They have parents and grandparents that remember what it was like. And that's much less the case in countries where measles has been absent for a long time. I personally think we have a lot to learn from the countries that where measles is endemic, is currently circulating, and have been using new strategies for vaccination, new strategies for outreach, new strategies to encourage everybody to seek vaccination. I think there's a lot to be learned from those countries and try and bring some of that expertise and operational expertise at the clinic level and at the public health scale back to countries that are now fighting to hold the line and keep measles at bay.